Testing.
Good morning. Testing 1, 2, 3.
Good morning. Testing 1, 2, 3.
Hi, hello, good morning. Just testing again.
Testing. This is Apple here. Good morning. Testing 1, 2, 3. Do you hear me? Good morning. Testing 1, testing 3. Testing 2, testing 3. This is Mina here. Testing 1, testing 2, testing 3. Good morning. Mic testing.
Hi all, final test, Dr. Asma. Final test, Dr. Asma.
Hi, can you hear me? Alpha here. We will start our live session in a couple of minutes. For those who have joined us, thank you, and please be patient while we wait for a few more people to join in. So please feel free to share the link to this live webinar with your friends and family. We're waiting for 10 a.m. before we start. start our live session now. Hello, good morning. Welcome everyone to the Malaysian Association of Orthodontists International Scientific Conference and Trade Exhibition webinar series. This webinar, which is jointly organized by the Malaysian Association of Orthodontists, University Malaya and University Kebangsaan Malaysia, is part of a public health awareness program to promote and increase awareness about orthodontic treatment. My name is Dr. Alfa Dahlia. I am an orthodontic specialist and a lecturer at the Faculty of Dentistry, University of Malaya, and I will be your host this morning. So we have an amazing lineup of speakers this morning. If you haven't already done so, please share the link to our live video to your friends and family. So it should be in the comment section of the YouTube channel now. The link to our live webinar. Please share this to your friends and family, your mom, your dad, your siblings, cousins, basically everyone in the different WhatsApp groups that you have, because we will be discussing on exciting topics regarding your oral health and possible problems with your teeth, your bite, if you have jaw issues, etc. So everyone can relate to these topics, and we have also experts in the field to discuss this live. So definitely not a chance for you to miss out on. So just a few housekeeping rules before we start. If you have any questions or comments, you can type in the chat box and I will read them out loud to our speakers during the question and answer session at the end of our presentations. Please mention which speaker you want to address your question to. So if you're not sure, basically the tentative for this morning is we'll be having 3 speakers who will give the presentations first, and then at the end, it will be the question and answer session with all the speakers all together. All right, e-certificates will be issued to you if you fill in our feedback form. We will post the link in the comment section at the end of the presentations, and I will also post the QR code to the feedback form for this at the end of the webinar. This webinar will be recorded for audit purposes, and it may be reposted on the Malaysian Association of Orthodontists social media platforms for our members to revisit, and also it will be available for public on the MAO website as well. Okay. Our first topic for this morning is the perils of fake braces. As orthodontists, we think this is a very important subject to talk about with the public. Nowadays, it is so rampant, so common to go on social media and you find people advertising their braces treatment to the mass public with testimonials and reviews and colorful pictures. So, it used to be cheap veneers and whitening products. Now it's all about cheap braces, and it's becoming an alarming trend among youngsters. So without further ado, let me introduce you to our first speaker, who is also my dear friend and colleague, a super mama and brilliant academician / orthodontist, Dr. Yasmin Kamarudin. Hi, Dr. Yasmin, how are you? Dr. Yasmin, are you here with us now? I think you're still mute. Do you want to unmute yourself? Okay, in the meantime, I'll just give a brief introduction about Dr. Yasmin. Dr. Yasmin Kamarudin. Hi, Dr. Yasmin, how are you? Well, we heard you for a bit just now, but now you're back to mute.
Oh, really? That's strange.
Okay, now we do hear you.
Okay, maybe I'll just get rid of this fancy headset, shall I? So you can hear me?
Yes, I think so. Yeah, now it's perfect.
Okay, great.
Are you all right?
Yeah, I'm fine.
Yeah, you look amazing, by the way. Right. Dr. Yasmin Kamarudin completed her undergraduate dental studies at University of Western Australia and graduated with honors in 2008. Since then, she has completed her specialist training in orthodontics at University of Bristol, United Kingdom. She graduated in 2017 with a doctorate in dental surgery and was awarded the prestigious Harry Orton Prize for Best Academic Performance by a postgraduate student at the Bristol University Orthodontic DDS MOth program. She also received a prize for Best Research Poster Presentation at the British Orthodontic Conference in 2016 for her study on prolonged antimicrobial properties of a novel mouth rinse. Currently, she is an orthodontic lecturer at the University of Malaya, where she supervises both the undergraduate and postgraduate dental students. She has an interest in research involving fake braces and social media in dentistry. Okay, Dr. Yasmin, whenever you're ready, you can start presenting.
Yeah, thank you. So what's a live webinar without some technical glitches, huh? So as long as you can hear me now, that's great. So good morning, everyone. Thank you so much for tuning in this morning on your Sunday morning to listen to me. And also thank you, MAO, for inviting me to give this talk this morning. So without further ado, I shall share my screen so I can start my presentation today. Right, so Dr. Alpha, you can see my screen?
Yes, perfect.
Okay, great. So let's get started. The topic today is the perils of fake braces. I have given this topic before, so some of you may find it familiar if you tuned in to me before. That's me, but Dr. Alpha has already given a nice introduction, so let's get started. Right, so fake braces is a problem that we face here in Malaysia, as well as other Southeast Asian countries such as Indonesia, Thailand, and Cambodia. So I'm just going to go through a few newspaper screenshots that I took online just to show how they keep popping up in the media. So this is dated 2013. So way back in 2013, this is the UK Mail. It says, brace yourself, Asian teenagers are wearing fake dental train tracks. And this is another article, 2013, again, just highlighting the issue that was mainly at that time in Southeast Asia, so Thailand, Indonesia, and Malaysia. And this is the latest article that I found. So it's in the Star paper. Fake dentists are making a comeback at the unlikeliest places. So this was early this year, 2021. So you can see even almost 10 years later, fake braces is still present and it's still popping up in the media. So what are fake braces? Basically, fake braces, they're braces, you know, the thing that you put on your teeth to straighten them, but they're done by unqualified individuals, someone that's not even a dentist, okay? So no official training, and they're not registered or recognized as a dentist in Malaysia. So you often hear terms such as fake braces or fashion braces, and they're used interchangeably. They basically are referring to the same thing, okay? Dr. Alpha, if there's any problem with me freezing or my voice goes, just let me know, okay? So I can do some troubleshooting.
I'll let you know, but at the moment it's great, it's fine.
I hate talking to myself, you know, who knows? And someone might come and disturb me anytime, you know, some little monsters running around. So I do apologize. All right, so let's talk about the two types of fake braces. I've broken it down to two. We have the click braces. So for me, the click braces truly represents the fake braces term because it looks like braces, but they don't work. They don't act like braces. It's more of an accessory or fashion, for fashion. So you simply clip them onto place on your molars. They're similar to you buying some Dracula teeth for Halloween. You know, you wear it, you smile, you scare people, then you take it off. But there's a second type of fake braces, if you see the photo on your right. Now, for me, this is more concerning. I put a question mark there because if you look at the photo, can you even tell if they're fake braces or not? I mean, they have all the main components of braces. They have the bracket, those little things, squares on the teeth. They have the wire, and they have those colored rings. So essentially, they're braces. And they're even glued to the teeth, so you can't take them off. And once they're glued to the teeth, they're going to start moving the teeth. So I think the term fake braces can be quite misleading because you assume that they're fake, so they're not actually doing any harm. It's just like, I suppose, if you talk about counterfeit bags, an LV bag, for example, you call it a fake LV bag, but you don't call it a fake bag because it's still a bag, even though it's going to maybe fall apart after a week or something, it's still a bag. But for the purpose of today's webinar, I shall refer to these cases as fake braces, just so I don't confuse anyone. Right, so what are the characteristics of fake braces? I've broken this down to 3. So there's the provider, the person that puts the braces on, the location that the treatment is done, and also the materials and equipment that they use. So all of them have something in common, which are basically they are unregistered, okay? So let's look more closely at the provider. So typically the provider is aged 13 to 30 years old, so they're quite a young age group. Can you imagine a 13-year-old putting braces on for you? Usually they're female, but we do have some cases of males as well. And they do not have any formal training. Usually they know how to put, braces on because they watch some YouTube videos or they learn from their family and friends that offer fake braces. Or sometimes they even go for these short courses by other fake braces providers, and they're given certificates, okay? So they may be duped in thinking they're actually learning something and it's legal. Some may even be unaware what they're doing is illegal, as I mentioned just now. So if you look at this 2017, sorry, covering my own slides now. All right, a 20-year-old woman providing fake braces actually lodged a police report because her customers were not paying her. But unfortunately for her, she ended up paying a 700,000 fine and a 1-year jail sentence because of providing fake braces. So I guess just this highlights that perhaps the awareness issue is not just on the patient side, but also the provider side, because they may not know as well. Right, so according to the Dental Act 1971 and 2018, if you want to perform dentistry in Malaysia, you need to be registered with the Malaysian Dental Council, okay? And every year you need to get your annual practicing cert ready, all right? Otherwise you're not registered to be working as a dentist in Malaysia. And of course, this is done so that we can maintain the standard of care and safety for our patients. So let's look, what is the definition of dental treatment? So if we look at the Dental Act, dental treatment specifically refers to the inserts or attempts to insert any artificial teeth or appliances for the restoration, regulation, or improvement of the teeth or accessory structures. So as you can see, fake braces definitely falls in the category of dental treatment because we're putting something on the teeth and we're attempting to remove the teeth. So hence, it is a violation of the Dental Act if you are unregistered individual performing fake braces. Right, so next, let's look at the location where fake braces treatment is usually carried out. Right, so usually it's in a non-clinical setting. So you have home services, so either you go to their house or they come to your house. Beauty salons, homestays, so they rent a homestay for the weekend and they do the treatment, or it's just behind a shop lot. And it's not uncommon as well for them to constantly change the location of where they're offering the fake braces. So I've just put some pictures here, for example. So your top right photo would be your typical spa setup. Okay, so the beautician will be offering fake eyelashes, hair extensions, and throwing in some fake braces as well as part of a package. So I think patients that go here, they may get confused and think it's okay to have it done since it's being offered at the spa. The photo on your bottom right is more your basic setup, someplace dirty, just a little blanket and some pillows, and you don't know when's the last time they washed the pillows. On the middle photo is a picture of a chair, foldable chair. Now we have had reports of patients claiming that they were using the provider was using an actual dental chair to do treatment. So they got confused. They were not sure if it was a real dentist or not. But I suspect sometimes, even if they use a foldable chair, like in the photo, it can be quite misleading to patients if they don't know how to differentiate a dental chair and something foldable like this. Right, so these are just some adverts that I grabbed from social media, just typically how they would promote their services. So you can see it says Ipoh open today. So usually we would have what we call traveling providers. So maybe they're based in KL, but for the weekend they'll go to Ipoh, rent a homestay and do some fake braces. And then maybe the following weekend they go to Malacca. So that's pretty much how it is. Now, for any private clinic or healthcare facility in Malaysia, you need to actually get registered under the Private Healthcare Facilities and Services Act. This is the same reason as just now why you need to register as a dentist, is to ensure the safety of the clinic. They need to make sure that it's safe for the patient to get the treatment done. So let's look at the point number 3 in terms of the material and equipment that are used by the fake braces provider. So typically they're very, very cheap. They're bought off the black market and they're of poor quality. So if you look at the Medical Device Act 2012, any medical device that you intend to use, it needs to be registered with the Medical Dental Authority here in Malaysia. And again, this is to maintain product safety and quality of the products. You wouldn't want to use any random medical device on yourself without knowing that it's safe and it does what it's supposed to do, right? So what is a medical device? A medical device basically is any medical device. It covers any product used in healthcare for the diagnosis, prevention, monitoring, or treatment of illness or handicap, but excludes drugs. So basically anything that you're trying to use as a medical in healthcare. So even your Apple Watch, if it has monitors your heart rate and heart rhythm, is considered a medical device too. So who is responsible to register this equipment? It's either the manufacturer of the device itself, or if you're importing something from overseas, then you need to have a representative of the foreign manufacturer here in Malaysia. So after all that, why are people seeking fake braces? There's a few reasons, which I've listed here. One is it's cheap, it's very cheap because the products, like I said, are poor quality. It's very convenient as well. You can just, for example, they come to your house, you don't even have to get out of bed, and someone can come to your house and put the braces on. You can have appointments at midnight as well. I've heard cases where they had the appointments at 12 o'clock at night. And then there's all the fashion aspect of it. You have all the multiple colors, shapes. If you look at the photo on your right, those colored rings are shaped like Mickey Mouse with ears. Of course, they look, cute, but as an orthodontist, usually we wouldn't recommend something like that because it would be harder for the patient to keep clean. Then there's influence by friends and peer pressure. So it's like, oh, my friend is wearing this, okay, I'm going to wear it. Or my friend is going to get the braces done, so I'm just going to accompany her to the appointment, and then somehow you get sucked into it. Then there's the status as well, because braces are expensive. So it's like, you can afford something. Then there's lack of awareness. The last one, desire to improve appearance. I put a underline under this because some actually wear braces because they want to move the teeth and fix their teeth. So that's why I don't agree with the term fashion braces, because if you're trying to improve your appearance, then it's no longer just for fashion. Right, so typically, I see there's sort of two types of patients. You'll have those that they know they're receiving fake braces, they know the problems that can happen, but they're willing to take the risk. Then you have another group where they kind of know it's not a dentist, obviously, because they're getting treatment done in a hotel somewhere, but they don't really know that it's wrong. They get duped, some of them, for example. They think, oh, it's a dental student and it should be okay. So it's sort of wrong, but not entirely wrong. So I think those are the two groups. Right, so next I shall be moving on to a role of social media in fake braces. In particular, we're talking about Instagram and Facebook. So just checking my time here. Right, so if you look at this article in the Star paper, where they did a scan of unlicensed dental services on Facebook and Instagram, you can see more than half are associated with fake braces. And the type of services that they offer would be, fitting the braces adjustment, braces removal. So you see, just because they put the braces on doesn't mean they offer braces adjustments or removal. Sometimes they just put it on and leave you to it, and you have to shop around for another provider. Then I've come across rescue service as well, where they promote themselves as being better than the others, and they can rescue all those failure cases from the other providers. Super cheap. So let's look anywhere from 180 to 350. That's really cheap. And they always offer freebies as well, cleaning, whitening. They also sell some products as well. For example, on your top right there, you have brackets selling for just 15 ringgit a whole set. They offer other dental treatment as well. Typically, it would be something like whitening, veneers, and scaling. Non-dental treatment, the hair extensions, the eyelash extensions. I've also come across this whitening drip, which I'm not sure what it is, but hopefully it's not some Clorox in there. They do agent recruitment as well. and dropship. So the more customers you bring in, you can actually earn a slice of the pie. So about here, it's 5 to 20 ringgit for each person you bring in. Training and masterclass. So this is what I was talking about earlier. They actually do classes and they offer certs. And sometimes you get celebrity endorsements as well. So this was early this year where a local celebrity promoted the fake veneers that she received. So of course, when you have stuff like this in social media and in the media, it kind of confuses the public because one, you might want to follow what your idol is doing, and number two, if you think, oh, if she's doing it and she's she's an artist, then it has to be safe. So they might go ahead and try. So now let's look at the legal aspect. Of course, I'm not a lawyer, so it's not my area of expertise, but let's look briefly at the legal aspect. So fake dental services, they violate the Dental Act 1971 and 2018, as well as the Private Healthcare Facilities and Service Act. And if you violate these acts, you can be fined up to 300,000 and or jail sentence up to 6 years. So that's quite a hefty fine and quite a long jail sentence. And according to the Oral Health Program in KKM, more than 50% of the yearly complaints of illegal dentistry is specifically due to fake braces. So if you look at this chart, okay, from 2014 to 2020, the blue line shows the complaints for illegal dentistry, and the red line is specifically for fake braces. So it's quite obvious we have an upward trend here, and also fake braces comprises more than 50% of the cases. A slight dip in 2020, but I think we all know why the dip is there. No one's allowed to leave the house, me included. So your complaints come from a variety of sources. Either the patient's complaining because they're not happy, they've got some complications. It can be the provider as well, if the patient's not paying them or they've got some disputes. And also from the public, if they notice something dodgy going on, they may put a complaint in. There have been prosecution over the years. So 2018, it says here, fake dentist gets fined 100,000. Another one here, 100,000 for offering unlicensed services. But if you look at this graph, again, from the MOH, the Oral Health Program, you can see in blue is the number of cases that were actually successfully prosecuted. So you can see, even though there are complaints, that doesn't mean you would actually reach prosecution due to several reasons. All right, so I'm just going to briefly go over the difficulties in combating fake braces. So we're looking at the patient aspect, legal and provider aspect. Taking my time here. All right, so from the patient legal aspect, again, this is not my area of expertise, but basically we have the dental enforcement officers in KKM, and they're in charge of looking at the complaints, including fake braces. So prior to the implementation of the Dental Act 2018, they lacked authority to conduct raids, and this obviously hampered their efforts. And also, it's not as easy as you think, you complain and straight away you can prosecute someone. There's all the prosecution elements where you have to build up the case. For example, you need to catch them in the act, get the patient, get the equipment, get the witnesses. It's just like all those crime movies that you watch, they don't solve the case in one episode, they drag you on for a few seasons because you need to build up your case, find a murder weapon, find a DNA, and all that kind of stuff. In terms of the provider, they change their social media quite frequent, so you can report it, it can be shut down, they'll just open a new one. You have by invite only WeChat groups as well, for example. So if you want to spy, it's quite hard because you cannot enter the group unless you know someone that's in there. In terms of location, they can be quite elusive as well. They keep changing and changing location, and sometimes they will only message you a few hours before your appointment to tell you where the appointment is going to be. And the last one here, I put community support. So I'm sure most of you can remember the case, this is 2017, fake dentist in Malacca is out of prison thanks to supporters who paid her fine. And this is just a quote from the paper article. Our organization has always been looking forward to helping hardworking and sincere Malaysians. They are assets to the country and should not be left alone. So obviously, again, when you have stuff, everyone's entitled to their own opinion, okay? But when you have stuff like this highlighted in the media, it can be, again, misleading, and it sort of doesn't really show how serious of an offense it is. Okay, next we're looking at the patient aspect. Sometimes they don't come forward to complain because they feel ashamed, they feel guilty. They can also be scared for safety reasons. They're worried that they might, the fake braces provider might come and find them. There's peer pressure because their friends are getting treatment with this fake braces provider. So if they report, then their friends will all be left hanging. You have lack of awareness, lack of knowledge, and not sure how to report. So let's talk about fake braces awareness. I'm just quoting a local paper here in 2019, where they did a survey on youth 19 to 25, and they found that majority knew about fake braces. So I think we've done a good job in terms of promoting promoting the issue of fake braces. However, only 35% were aware of the complications. And that brings me to the next part of my talk today, which is the fake braces complications. Right, so if you're looking at the person providing the braces, as we said earlier, they're not trained. So they don't have knowledge. They simply just stick the brackets on your teeth. So obviously they're not taking any records. They're not doing a proper treatment plan for you. They're not going to take x-rays. They're not going to fix the decay in your teeth first, all those sort of things. And because they don't know what they're doing, the teeth can move in directions you don't want them to move. So if you look at the photo in the top right, the root has been moved out of the bone. And the bottom photo shows the patient has other dental issues, for example, caries, gum disease, which was not addressed. In terms of the location of treatment, obviously these places have poor infection control. So you are at a risk of developing infectious diseases, for example, HIV, hepatitis, and other airborne diseases such as COVID. And I was quite surprised to find, when I surveyed through the social media pages, they're still operating even during MCO period. Okay, so that's quite alarming. There's also safety issues because you're going somewhere secluded by yourself to get treatment. In terms of the material, they're very cheap, poor quality, so you have risk of allergies, poisoning, and inhalation. There have been some studies showing that the surfaces are very rough. There's iron leaching from the brackets. And there've been, this is just one case where this patient had swelling of the lips after getting the fake braces, maybe due to allergy or even burning of the lips from some chemicals. And there've actually been 2 deaths so far related to fake braces. So this is back in 2013, and this was in Thailand. I think it was a 14-year-old and a 17-year-old. So I am a bit short on time, so I think I'll to go through maybe 1 or 2 testimonials. So these are just cases that I came across patients, and I'm just highlighting issues that they went through and their experience. So this patient, they said they started off with the fake braces provider. They jumped around, they lost confidence, and they ended up buying the stuff online themselves and doing their own DIY braces at home, which of course turned out tragically wrong. And he ended up chipping his tooth when he tried to remove the braces himself with nail clippers. This other patient said they were not actively searching for fake braces, but the adverts kept popping up. So finally they got intrigued, and they kept changing the appointment of the location of the appointment. And she felt that she was always being passed around. So today the appointment would be with so-and-so. The next day it would be some uncle or some brother or auntie that, maybe not auntie, cousin that's doing the treatment. And she also felt regret because even though she thought it was going to be cheaper, in the end she ended up spending quite a lot, and she also ended up redoing her braces. This is just another case as well, talking about the provider that was giving treatment. I think she was still in high school. Sometimes she wore her PJs when doing treatment on me in a hotel room. I doubt she even showered. Her hair was messy. So that just gives you a bit of a glimpse of the situation and how unhygienic it could be. This is another one, treatment done at a hotel. So receptionists came to make a complaint, and they were instructed by the provider to lie and say that they were there for a makeup tutorial. And this patient also ended up redoing the braces. This last patient, she said the person claimed to be a dental student, and they thought it was okay for her to do the treatment on her. She was practicing to say. Right, so now I'm just going to finish off my talk, just going through the role that everyone needs to play in combating fake braces. Let's look at the role of the dentist. So you'll get 2 types of patients coming in to see you. One would be the fake braces patient that is unhappy, they've had complications, and they want you to fix it. The second one would be someone that's wearing fake braces, but they've come for something else, maybe a scaling or a filling. So you may not entirely, they may not be upfront. So you need to be able to identify these patients. One, history is very important. So you need to ask them, where did they get their treatment, how was it done, and things like that. Usually the braces are quite short. They don't have bands. They have really colorful ligatures, and the oral hygiene may not be the best as they're not being looked after. So you need to identify the patient, educate, and then advise the patient. So now moving on, almost finished, Dr. Alva. Role of the patient, okay? So as a patient, if you are not sure if your dentist is a real dentist or not, you can go to dpims.moh.gov.my. You can type in the name of the dentist. If the name pops up, then good, they're registered. If they're not, then yes, they may not be allowed to work in Malaysia. If you want to look for an orthodontist, you can go to our www.mao.org.my and you can search for the orthodontist in your area. In terms of the premise, if you go to a place and you think, something's not quite right here, I'm not sure if it's a real clinic or not, you can actually look for registered private clinics on www.medicalprac.moh.gov.my. You can even ask the dentist to show you their APC to show that they're allowed to work. In terms of lodging a report, you can go directly to the Oral Health Division, Ministry of Health, ohd@moh.gov.my, or you can directly report to the Malaysian Dental Council, MDC at moh.gov.my, or you can even make a police report. In terms of the social media pages, you can report directly on the pages, or you can again report those pages to the Oral Health Division of MOH. And I think that brings me to the end of my lecture this morning. Just on time, I hope. 1 minute of time.
That's fine. Thank you very much, Dr. Yasmin, for enlightening us with this alarming issue on fake braces. I find it very informative, and I hope our audience are more mindful when they see this pop-ups or fishy advertising of this fake braces treatment online. We don't want to become, a victim of these providers. I always tell my friends and family and even my patients, cheap dentistry is for those who are rich, because you cannot afford to do something. You want to get it right, spot on the first time, especially something like orthodontic treatment. So yes, make sure, like Dr. Yasmin said, find a registered dentist and orthodontist. Okay. I'd also like to thank everyone who is still here with us today, still with us now. We really would like to hear from you, and would like to include your voice in our conversations. So feel free to ask questions, share your comments, even if you want to challenge our ideas, you can feel free to use the chat box at any time during this webinar. However, like I said, we will get back to you with the answers at the end of the talk with the rest of the speakers. All right, so let's move on to the next topic. It's quite a long one, this one. Not the talk, but just the topic is quite a long one. My child has an underbite. It seems like the lower jaw is sticking out. So what should I do? So anyone in the audience have this problem or know anyone with this problem? So you can send us some comments in the chat. All right, so basically the issue here is when children's bottom jaw is slightly ahead than the top jaw. So, the position of the top and bottom teeth is not right, and this may affect their bite. So we have another expert in the field to discuss this topic with us. Please welcome Dr. Lau Mei Na. Hi, Dr. Lau.
Good morning.
Are you here?
Yes, I'm with you now. Can you hear me?
Great. How are you?
Good, good.
Yeah, we can hear you perfectly well.
Thank you.
Okay. Dr. Mei Na is also my awesome colleague in UM. She's very intelligent, very hardworking person. We work together, but this is our first time sharing a platform together here. So I'm very honored to have you here today.
Thank you for having me.
A brief introduction about Dr. Lau Mei Na. She is a lecturer and orthodontist at the Department of Pediatric Dentistry and Orthodontics, Faculty of Dentistry, University of Malaya. She obtained her first degree in Bachelor of Dental Surgery from the University of Malaya in 2008. After working as a dental officer in the Ministry of Health, for 5 years. She attended the University of Malaya again in 2013, where she earned her Master of Orthodontics with distinction and the membership in orthodontics from the Royal College of Surgeons of England in 2017. She joined the University of Malaya as a lecturer in 2018 and is now actively involved in the teaching of undergraduate and postgraduate students, research, and treating her own orthodontic patients. Her areas of research interest are orthodontics, retention and relapse, teaching and learning, mandibular advancement, appliance therapy for obstructive sleep apnea, and cleft lip and palate abnormalities. Okay, over to you, Dr. Lau, whenever you're ready.
Thank you. All right, let me share my screen. Let me know if you cannot see it. Is it appearing on your screen now, Dr. Alpha?
Yes, I can see your slide.
Great,
yes.
thank you. All right, once again, thank you for joining us this morning. I would like to take the opportunity to thank the Malaysian Association of Orthodontists for giving me this opportunity to share a little bit about underbite with all of you today. So once again, thank you for the kind introduction, Dr. Alpha. And yes, my topic initially is quite long, but essentially what I want to share is about underbite. If your child has an underbite, what should you do? So as an introduction, what is underbite? Like how Dr. Alpha has briefly discussed with you just now, underbite, or you can call it a reverse bite, is a dental condition where the lower front teeth jut out further than the upper front teeth. So it can involve one or more teeth. In the clinic or when you are searching using Google, and you may come across other terms that describe the same thing, anterior crossbite or class 3 malocclusion, they all actually explain about the same thing, which is this underbite condition. So it affects roughly about 5 to 15% of people, and it is actually more common among Chinese and Japanese. So when can you start to notice a development of an underbite? So you can start to notice underbite in your child when the permanent adult front teeth come in to the mouth. So usually the lower central front teeth will come in first, around 6 to 7 years old, followed by either the lower side front teeth or the upper central front teeth around 7 to 8 years old. Last but not least, the upper side front teeth around 8 to 9 years old. So around this time, you may start to notice if your child is having an underbite. Essentially, there are two types of underbite. We can call it dental underbite and skeletal underbite. Of course, perhaps your clinicians, the dentists or the orthodontists may have different terms, but no worries. They basically mean the same thing. So if your child has an underbite that is only involving the teeth, where the lower teeth, the lower front teeth are positioned slightly forward compared to the upper front teeth, but the lower jaw does not protrude forward. So I have a figure on the upper top left over here. If you look at your child at the side view, if you do not notice any unusual forward protrusion of the lower jaw, your child might have just the dental underbite. However, if you notice that the lower jaw is slightly longer, perhaps it protrudes forward beyond the upper jaw, your child might have a slightly more severe underbite, which involve the bone as well, where we call a skeletal underbite. However, not all skeletal underbite are true skeletal underbite. There are something that we term it as a pseudo or fake skeletal underbite. So let me show you using this video that I got from the YouTube as well. So you can search on YouTube too. So a child might have a dental underbite, but he or she is not comfortable biting at one position and the lower jaw shift forward, thus appearing like he or she is having a skeletal underbite. So don't worry if you do not know how to differentiate between dental underbite and skeletal underbite. Bring your child to seek professional advice from the clinic, the dental clinic. The dentist might be able to diagnose and help you to tell you, what types of underbite your child is having. So moving on, you may start to wonder why my child has an underbite. What are the common causes? Perhaps I can, do something now to prevent an underbite from happening. Unfortunately, most of the underbite are a little genetic related. That means if any of the family members are having a tendency or an underbite, your child might have a chance of having underbite as well, especially the skeletal underbite. However, it can be caused by several other common causes too. One of it, we call it crowding. So don't be afraid of this term. Crowding simply means that the teeth do not have enough space, in the mouth. So certain teeth might move inward or outward from where they should be. So if you look at this figure, some of the front teeth have crowded inward. So if your child has crowding, that means there is not enough space for all the teeth to come in the mouth. And if the upper front teeth crowded inward or the lower front teeth crowded outward, underbite can develop. Rarely, but possibly, underbite can develop due to habits as well. So, for example, if your child is constantly biting the upper lip, so this habit and the force of the upper lip might push the upper front teeth backward, thus causing an underbite. Rarely, if your child like to pull the lower front teeth forward, either using cloth or any rubber, any habit that bring the lower front teeth forward, an underbite can develop too. You may have heard about cleft, either cleft lip, cleft palate, or cleft lip and palate. Patients or children with cleft might have an underdeveloped, a smaller upper jaw, thus having the upper front teeth slightly positioned backward compared to the lower front teeth, thus having an underbite. If injury has happened to the baby front teeth, severe enough to disturb the adult front teeth that is forming in the bone at that time, the position of the developing adult teeth in the bone might have changed, thus causing underbite as well. So moving on, an important question to ask: what age should you get your child checked if you are suspecting that your child is having an underbite? When should you fix an underbite? The answer is as soon as possible. Early diagnosis with a specialist orthodontist can provide appropriate information for you and also best advice to manage an underbite problem. It is very important to get checked and fixed as soon as possible to avoid having complications of untreated underbite. So you should not wait. Don't wait until all the baby teeth have fallen out and all the permanent adult teeth has come in to consider a treatment of an underbite. I showed some photos here. On the left, as you can see, one lower front teeth is having a dental underbite with the upper front teeth. The lower front teeth jut out further forward compared to the upper front teeth. If you can look at the level of the gum, the teeth that is involved in the underbite are having the level of the gum slightly shrink from where it should be. So over time, this can get more and more severe, and the support of the teeth from the gum and the bones around it inside the gum may become less and less. Ultimately, the teeth can become mobile, shaky, having a more severe gum problem. Rarely, it may cause gum problem on the top front teeth as well. For your information, this is a photo of my own son. He's 10 years old now, and he has his underbite treated. So what happened is that my son has what we call as the pseudo-skeletal underbite. He had a fake skeletal underbite. So he's not comfortable biting in underbite, and he constantly bring the lower jaw forward. And because of the shift of the lower jaw forward, he keep pushing one of the upper front teeth forward, and it is almost, out of the envelope of the protection of the gum. So this can happen as well. And it can also cause tooth wear because some underbite are biting edge to edge, or because of the fake skeletal underbite where they constantly bite and shave, it can cause wear at certain part of the teeth that is involved. So on this photo, it is not very severe, but as you can see, the shape, especially at the edges of the lower front teeth, the left and right lower front teeth, are slightly different. This is slightly rounded because the corner of the teeth has been worn down compared to the original shape of the teeth. So if it is untreated for a long term, a further tooth wear can happen. How to treat an underbite? I'm sure you are interested to know what are the options you have. Please bear in mind that the sharing this morning that I would like to share with you is so that you have this awareness to get it checked and fixed as soon as possible. So this type of treatment, we call it interceptive treatment. What is interceptive treatment? Interceptive treatment simply means any early treatment that eliminates or reduces the severity of an developing condition. In this instance, in this case, it's about underbite. This is because we want to prevent the underbite to become more severe, and the condition to become more severe, and to prevent the complications that we have discussed earlier. So what are the common interceptive treatment options available if a child is having an underbite? So if your child has dental underbite, commonly there are two options available: a removable brace or a partial fixed brace. I'll discuss these options one by one later. And if your child has skeletal underbite, diagnosed as having skeletal underbite, there is another option called a face mask. First, let us start with removable brace. To be exact, an upper removable brace, and a removable brace that we construct for the child to wear on the upper teeth. So it is a brace that is removable. That means we will teach your child how to wear and remove the brace. Because your child can remove the brace, if they are not cooperative, they are not convinced, they do not like to wear the brace and constantly keep on removing the brace, the teeth will not move. Thus, it may fail, the treatment may fail. So it is for what we call as compliant, cooperative, or children that want to wear the removable brace, perhaps a slightly older age. What is the benefit of removable brace? Why usually a dental provider, a dentist or an orthodontist usually choose this as their first option? This is because the child can remove the brace, and it is easier for them to clean their teeth effectively. So let me show you how upper removable brace work. So you can find and locate this video online on YouTube as well. So this is one type of upper removable brace having a screw that can push 4 upper front teeth forward. So we'll teach your child how to wear it. We'll teach them how to turn the screw. They shall turn the screw once a week, and for a month, the screw will be able to push the upper front teeth forward by 1 millimeter. So depending on how severe the dental underbite is, we can turn the screw until a desired outcome achieved. Like I told you, there are many other types as well. Not all types look like this. So especially if, for example, the underbite only involves 1 or 2 teeth, you may have an upper removable brace that looks slightly different from what you saw from the YouTube link YouTube video just now. So for example, this is an upper removable brace to correct one teeth that is in dental underbite. So there is a component over here, we call it a Z spring. It is a component that the dentist, the orthodontist can activate and bring the teeth in concern forward so that it is biting normally and healthily with the lower front teeth. All right. I hope you're still with me. I hope it is not too heavy for an early morning. Second option is what we call as a partial fixed braces, and it is for the upper teeth as well. So if your child might not like the idea, they might be not motivated, they fail to wear the removable brace, you can consider this option because it is fixed on the teeth. It is glued professionally on the teeth. So like it or not, the child cannot remove it. The teeth can constantly move according to how the orthodontist plan. However, because the child cannot remove the fixed brace, it is harder to brush the teeth compared to the first option, isn't it? So it is only for kids that can show good oral hygiene. So if your child are having some trouble, some difficulty to maintain good oral hygiene, we will teach them how to brush well, and if they can cope, then this option might be for them. So it doesn't look different from the usual fixed brace that including all the photos Dr. Yasmin shared in the first lecture. However, it is called partial because it is only glued on the permanent teeth. So because this is usually, you can start to notice an underbite around 6 to 8 years old. And for interceptive treatment, it is early. There are some baby teeth still around in the mouth. So we also call it a 2x4 brace because it involves 2 back teeth and 4 front teeth. There's 2x4 braces. So again, this is an underbite condition that involves one teeth, and with this partial fixed brace or 2x4 brace, we can correct the underbite. And perhaps one additional benefit compared to the removable brace, we can also straighten the teeth and close any space in between these 4 front teeth. I have to stress this, like I said just now, it is only for kids who can maintain good oral hygiene, who knows how to brush well. Of course, we'll teach them how to brush before wearing the partial brace, and also upon putting the brace for them, we'll teach them how to brush the teeth and the brace. It is very important because we want to prevent your child having what we call as a white spot lesion. So look at this zoom in figure. This is the normal shade, the color of the teeth. And if a child is struggling to maintain good oral hygiene, and if the teeth is dirty, the braces is dirty, the mineral can lost from the teeth, causing this white color tattoo, usually around the metal square of the brace and around the gum. You see? And for your information, this is not temporary phenomena. It is actually permanent. And once the treatment is completed, when we remove the brace, if the child can keep clean and improve on oral hygiene, usually this white spot lesion can reduce in severity by 50%, but the remaining white spot lesion will stay and for forever. So do take note that not all child is suitable for upper partial fixed brace. Okay, the last treatment options, especially if your child has a skeletal underbite, your orthodontists may propose something called a face mask therapy. It is also known as protraction headgear or reverse pull headgear. It's best for younger children, actually, best below 10 years old. So, like I mentioned just now, it does not only correct the dental underbite, but it can improve or correct the skeletal underbite too. And something very good about face mask therapy for a skeletal underbite is that it can reduce the need for jaw surgery in the future when your child enter adulthood. So what do we mean by that? The studies have shown that about 2/3 of children with skeletal underbite need jaw surgery when they turn into adulthood. However, if a child is treated with face mask therapy when they are younger, under 10 years old, there are 3.5 times less likely to need a jaw surgery in the future. So what is this jaw surgery that I'm talking about? This is some screenshot that I take from the British Orthodontic Society website on your jaw surgery. So you can Google your jaw surgery and get information about this surgery from this very good website. So for example, as you can see, this adult female is having the lower jaw protruding forward. And in order to treat the condition, sometimes when it is too severe to be treated just by braces, the braces treatment has to come together with a jaw surgery that position the lower jaw backward. So this is only one type of jaw surgery to correct this condition. There are many other types as well, depending on where is the abnormality or discrepancy. Some will require the upper jaw to the surgeon may bring the upper jaw forward without bringing the lower jaw inward, or it can be a combination of upper and lower jaw. So let me show you a simulation on how a face mask work. So you can see that this boy is having a dental underbite and skeletal underbite. Your orthodontist will fit a component that will be either removable or fixed in the upper jaw. And a face mask comprises of a rest on the forehead and the chin, and we will teach your child how to use an elastic to attach and combine both components, and this can bring the upper jaw forward and also the upper teeth forward, thus correcting dental underbite and skeletal underbite. I'll show you once again. So the child is having a dental underbite and skeletal underbite. Your orthodontist will fix a device on the upper jaw, the upper teeth, and the face mask. There are various types. This is one type of it. And an elastic that attach both components together, and it can bring the upper teeth and the upper jaw forward to correct the dental and skeletal underbite. So that's all from me this morning. I hope it is not too heavy for you. I'm happy to take questions. You can put in the chat box. We will address them together later at the end of today's sharing. Thank you. Over to you, Dr. Alpha.
Thank you, Dr. Lau, for the excellent presentation. So I hope our audience got a little bit of insight into the problem of an underbite, or what we orthodontists call anterior crossbite, or class 3 malocclusion, class 3 bite. So when you can recognize if your son or daughter has this problem, then perhaps you can seek the appropriate orthodontic consultation and treatment. So next we have our last speaker for this morning. Some of you might have seen her on TV or know her personally because she's quite the celebrity on social media. If you haven't already, you can follow her on her Instagram account. Dr. Asma Ashari. So that's Elias, Drasma Ashary. So Dr. Asma Ashari, where she frequently answers questions on braces and just teeth in general when asked by the public. Assalamualaikum. Hi, how are you, Dr. Asma?
Walaikum salam. Hi, how are you, Dr. Alpha? I'm good, thank you.
I'm good, very good, thank you. All right, just a brief introduction about Dr. Asma. She is a specialist orthodontist and clinical lecturer at the dental faculty in University Kebangsaan Malaysia. Presently, she is also a visiting specialist at Dental Avenue Klinik Pergigian dan Pakar Orthodontik, Putra Heights, and Twin Towers Medical Center, KLCC. As an orthodontist, Dr. Asma is qualified in the field of specialty dealing with irregularities in the teeth and jaws, and has been involved in the specialty since 2014. Her main interests are aesthetic ceramic braces and Invisalign. Dr. Asma did her bachelor in dental surgery at the University of Adelaide, Australia. She then worked in the Ministry of Health for a few years before she underwent specialist training at the Royal London Hospital, Queen Mary, University of London. She has passed her membership in orthodontics at the Royal College of Surgeons, Edinburgh, and she was also awarded the Robert Lee Award by the Royal London Hospital alumni. This award was used in an elective at Harvard's Advanced Graduate Orthodontic Program in Boston, USA. She was also awarded the Dental Clinical and Education Experience Fellowship by the Royal College of Surgeons of Edinburgh. In her free time, Dr. Asma enjoys running outdoors, playing table tennis, and traveling as well. So in UKM, she is also involved in various research collaborations with the Ministry of Health, UITM, as well as within the industry. She has also published research papers in leading journals and has been awarded research funding in recent years. All right, so Dr. Asma will be discussing with us an interesting topic, which is, again, it's quite a long topic, this one, orthodontic treatment for children, signs that your child may require early intervention. So I'm sure we have parents here with burning questions. When should I bring my child to an orthodontist? Will my son or daughter's teeth get more wonky or get straighter as they grow older? Just a few days ago, I got a question from a friend, and one last night as well, saying, the son is about 7 years old and has adult teeth coming through. And now, in her words, the whole mouth looks a mess with overlapping teeth. So it's this age range, isn't it? 7 to 9 years old, where the kids are in mixed dentition, what we dentists call mixed dentition, or the ugly duckling stage. So where teeth are just popping up everywhere and parents get a bit anxious. So now let's hear it from Dr. Asma. What are her thoughts on early orthodontic intervention? Over to you, Dr. Asma.
Thank you so much, Dr. Alpha, and thank you for the kind introduction. So my topic today will be about early interceptive treatment, and I've kept it very simple since it's for the public, and I will address some key points in Bahasa, so I hope it'll be helpful. Let me share my screen now. Can you see my screen?
Yes, Dr. Asma.
Okay, great. All right, so thank you again to MAO for inviting me to give this talk today. So my topic today will be signs that your child may require early intervention, or what we call interceptive treatment. If you have any questions, you can ask it at the end of the session. So what is interceptive treatment? Interceptive treatment in lay terms, meaning recognizing problems early to treat them. Why? This is to eliminate any possible treatment later. And another scenario, it can also minimize complex therapy. So this interceptive treatment is meaning that your child, if they have this early treatment, it could mean that they do not need braces in the future. And in another scenario, it would mean that they would still need braces. However, their treatment will be more straightforward and less complex. So dalam bahasa Melayu, rawatan awal ni bermaksud jika anak anda menjalankan rawatan awal ni, ini mungkin bermaksud mereka tak memerlukan braces nanti bila dah besar, atau mereka masih mungkin memerlukan braces tetapi jika menjalankan rawatan awal ni, braces mereka di kemudian hari mungkin kurang komplikasi dan lebih ringkas lagi rawatan dia. Alright. Okay, so here I'm just going to give you a brief introduction about the timing of eruption of teeth. And these are key points that I think parents should know. So the first point is the baby teeth start erupting around 6 months of age when they're still babies. And then at 6 or 7 years old, the baby teeth then start shedding and the permanent teeth start coming through. And then at 12, usually all the baby teeth will have finished shedding, and this is when you have all full permanent dentition. And this is when the earliest that braces treatment can start. So it's easy to remember, 6 months, 6 years, and then 12 years. So 6 plus 6 is 12, right? Okay, so untuk ibu bapa, kalau nak senang ingat, gigi susu kanak-kanak mula keluar masa dalam umur 6 bulan. Dan kemudian gigi susu mula gugur dan gigi kekal mula tumbuh dalam masa 6 tahun. Dan bila umur 12 tahun, semua gigi kekal akan keluar. Dan senang nak ingatlah sebab 6 bulan, 6 tahun dengan 12 tahun. Dan bila dah 12 tahun, ini adalah umur yang terbaik, umur yang terawal yang kita boleh pasang braces. Okay, so this is just important points that you can remember. And of course, it varies from children to children. Some can be a little bit late or a little bit early, and that's fine. Okay. Okay, so this is the ugly duckling stage that Dr. Alpha has mentioned earlier. At around 7 to 9 years of age, some parents are usually concerned because they think their child's teeth look a bit wonky. Usually there'll be a big gap at the front and the front teeth comes out like, flared. And usually this is when parents are a bit worried and say, are my child's teeth okay? Don't worry, this is a normal physiological development where we call it the ugly duckling stage. And if you can see with my laser pointer, the gap is there, but then the permanent canines, which is the pointy tooth here, is coming down. So as they come down, when they're about 12 or 13, the space will then start closing. So do not worry, this is a normal stage that they will encounter when they're in the mixed dentition. However, if they've already, all the permanent canines have come down and they still have the gap, then maybe you would want to get it checked at the dentist why the gap is still there when they're older. So the aim of this talk is to share with you the important signs that warrants early intervention in children. You can bring your child to the dentist if you have any of these signs for them to further investigate. I would like to reinforce that good oral hygiene, good diet, and regular dental checkups are important to maintain a nice, healthy smile. So, tujuan talk hari ini adalah untuk memberitahu ibu bapa tentang perkara-perkara penting yang mungkin anda boleh tengok dalam mulut anak anda jika mereka memerlukan rawatan awal ataupun tidak. Jika anda tak pasti, anda boleh bawa mereka berjumpa doktor gigi jika ada tanda-tanda ini, dan ini sangat penting untuk mereka membersihkan gigi dengan baik, makan diet yang elok dan sentiasa berjumpa doktor gigi secara berkala. So I'm going to share with you 5 signs that you need to look out for. One of the signs have actually been covered comprehensively by Dr. Maynard just now about the underbite. So I'm going to share with you the other 5 common signs that I think would be easy for parents to look out for in their children. And yes, again, I've kept it very simple and we'll try to say some important points in Bahasa so that hopefully it's easy for people to understand. Okay, sign number 1 is a significant gap between the top and bottom teeth, or what some people may call sticking out teeth. Atau dalam bahasa, orang kata gigi jongang atau gigi ke depan, gigi jongos kan, orang selalu bagi term begitulah. So you can see in all these 3 photographs, they all have something in common. If you can see the red arrow that I've put there, there's a significant gap between the top and bottom teeth. But please note, this is the permanent teeth, okay? So you have a look at your child when they are 6 to 7 years onwards when the permanent teeth have erupted. If it's just the baby teeth and if you think they have a huge gap, we can't really do anything when they're still in the baby teeth stage. So this is when you start looking when they're 6 to 7 years onwards. So why is this important? This is because a lot of studies, research have shown that these children are at higher risk to injure their front teeth and are more prone to bullying and teasing at school. So actually some research have shown if they have a significant gap, there are some 50% of these children have had some sort of injury to their front teeth. And most of them have had some sort of teasing or bullying in school, which affects their physiological well-being. and they are twice as more likely to injure their teeth as compared to their peers. This is very sad, and this is something that we hope that parents can detect earlier so that we can prevent these things from happening. If you look at the two photos here at the top that I'm pointing, these two kids are only about 13 or 14, yet they've had root canal treatment on their front teeth. To have root canal treatment on the front teeth at such an early age is not great, because it would need maintenance, it would need bleaching, or you would need a crown later on, and to think that they've had it at such a young age is not good. So when does treatment usually start for braces? If you remembered what I've said earlier, it usually starts around 12 years old. However, we might need to start treatment earlier if they've had injury to their front teeth before the age of, before the age of 12, when they still have their baby teeth. But if they've had injury to their teeth, or if they've had teasing in school, or if the teacher reports to you of them having tease for their teeth, then it might mean that they will need early treatment. So someone may ask, well, my child has a big gap between the top and bottom teeth, but then they've never had any trauma or bullying, or they've never had any injury to the front teeth. So does that mean I don't have to do anything now? So yes, if they're not 12 yet and they have a big gap, but they haven't had any injury or they haven't had any bullying, it doesn't mean that they need to start early treatment. However, they will need to wear a mouth guard if they play any sports, or contact sports like taekwondo, or if they play bicycle and things like that. They will need to wear a mouth guard to prevent any injury. The mouth guard can be done at the dentist, they will take an impression, they will take a mold of your teeth, or you can buy prefabricated ones online or at the sports store. So takeaway messages from sign number 1. If your child has sticking out teeth before the age of 12, have they had any injury to the front teeth or experience of being bullied? If yes, then they may need interceptive treatment. And if no, they may not need interceptive treatment, but they will need to wear a mouth guard for contact sports. Jadi kalau kanak-kanak anda mempunyai gigi yang terkeluar sebelum umur 12, mereka pernah tak patah gigi depan atau pernah diejek atau dibuli di sekolah disebabkan gigi mereka? Jika ya, mereka mungkin memerlukan rawatan awal sebelum braces tu sendiri pada umur 12 tahun. Dan jika tidak ada, mereka tak perlu rawatan awal, tetapi mereka masih perlu memakai mouth guard bila bermain sukan atau main basikal dan sebagainya yang ada risiko untuk terjatuh, kerana kanak-kanak sebegini adalah sangat tinggi risikonya untuk trauma ke gigi depan. Okay, so let's move on to sign number 2. I think some parents will probably smile if they see this, and if their children is thumb sucking habit atau kita panggil isap jari is, I think parents all know that this is not right and something needs to be done if they're thumb sucking, but I'm here to share with you more information of what you can do about it. Okay, so parents will ask, when do we ask our child to stop thumb sucking? It is important to start asking your child to stop starting from 2 years old. Otherwise, it will start having effects on the teeth later on. The effects on the teeth is actually not until later, but research has shown that if you start earlier for them to stop, it is actually more successful than rather than they're older and you start you ask for them to stop. So start from 2 years old. It's the same with other things such as pacifiers, puting, or bottle feeding. You need to start early, rather than late. So how long is too long? Thumb sucking for more than 6 hours a day is too long and enough to have an effect on the teeth. Some of the signs that you can look out for is they would have a blister or a callus on their finger. Sometimes a child would come to the dental clinic and say, yeah, I've stopped thumb sucking. And then when I look at their finger, they would still have that callus. So you know that, they're not telling the truth. So how would you know that your child may need early treatment? So if you've tried home remedies and they do not work by the time their permanent teeth have come through, it would mean that they would probably need interceptive treatment. What are home remedies? I will show you in the next slide. So these are the examples of home remedies that you can try at home. So number 1 is positive and negative reinforcements. What are they? So for example, if your child has successfully stopped thumb sucking for one night, you can give them a sticker and put it in a diary, or you can give them their favorite toy or more playtime, for example. And negative reinforcements mean that if they still haven't been successful for a week, for example, then you can take away their favorite toy and things like that. So you can sort of give them as boosters to help them motivate, and some patients actually find that, the parents will say, if you don't stop, I'm not going to give you braces. So it is a motivation for them as well. So a second method you can try is using socks or mittens. So you can put the socks in both hands and it has to be fairly tight. You can't just put it on one hand because obviously they're going to use the other hand to take it out. And it will help prevent inserting their thumb into their finger, into their mouth or any finger. Sometimes they use different fingers. Another method you can try is bitter nail polish. You can get them at the pharmacy or any online pharmacies, and it helps to create an unpleasant taste or smell on the thumb so that if they insert it, then they're not going to feel satisfied thumb sucking, so they're going to take it out. The last method you can try is a plaster, and again, the glue has to be quite tight so they're not able to take it off. And all these different methods work for different people. Some of my patients find that some methods work better than others. So don't just try one and give up. Try a few, and I would give it 1 or 2 months to try before I see them again and see if they have been successful. So you can try these at home if your child is thumb sucking and see if they work. What are the effects of thumb sucking habit? So you can see in the first photograph here at the top, there is no overlapping of the top and bottom teeth. This is what we call an open bite, where it'll be difficult for this child to bite on things with their front teeth. And in the bottom picture, this patient is a little bit older. She's 15. She has stopped the habit, but you can see if the habit is stopped quite late, even though they've stopped, the effects will be permanent. Even they stop the habit, they can't resolve spontaneously. So you can see how there is a big gap between the top and bottom teeth, and the lower teeth have slanted as well to accommodate the inserting finger. Another important thing for patients to know and parents to know is that braces can only start when the habit is stopped. So if they're still thumb sucking, you can't really start braces yet because the braces will produce a significant force on the teeth, and the teeth are like stressed, if that's what you call it. And if you put another additional force with the finger, it might damage the roots of the teeth. So we can't really start braces until they've stopped the habit. This is what we call a deterrent appliance, which is what we can put. There are different types, but I'm showing you one. We can put in the child's mouth. If the home remedies do not work, we would have to try and put this in. They're usually very effective because if you can see here, looking at my laser pointer, it has been glued on to the first permanent molars of the child. And there are metal spurs at the roof of the mouth. They're not sharp, don't worry, we're not that evil, okay? They're not sharp, but it's enough, it's blunt, but it's enough to produce like a really unpleasant sensation when they put their finger in their mouth, and it is usually very, very effective. So, but we do not want to put this in if we don't have to. So even if a patient turns up to me at, for example, 14, they still haven't tried the home remedies, I would tell the parent, do try the home remedies first for at least 1 or 2 months, because I don't want to put this in if I don't have to. So try the home remedies first, and if it still doesn't work, then you need to go to your dentist because the habit needs to be stopped before they start any braces treatment. So you can see an example of a case where I've used this deterrent appliance. So this is the photo I've shown you earlier where there's an open bite between the top and bottom teeth. We've inserted this deterrent appliance, and you can see how only after a few weeks the bite has closed down. This is of course in a younger patient that it may mean that they will not need braces again if they're quite young and detected quite early. But if they're a bit older, then the habits, they might still need braces. The habits may not, stopping the habit may not resolve the teeth. Okay. So for sign number 2, the key points that you need to take home is if they're still thumb sucking by the age of 6 to 7, have home remedies been successful? If no, then they may still need interceptive treatment and you may need to take them to the dentist. But if yes, they have been successful, then they may not need interceptive. And if their teeth are still not right, you can bring them to a dentist once they're in full permanent dentition, which is 12 years old, around 12. Okey, jadi untuk poin yang kedua, yang penting untuk ibu bapa tahu adalah jika anak anda masih menghisap jari bila dah umur 6 ke 7 tahun, iaitu bila gigi kekal dah mula keluar, kalau dah cuba benda-benda di rumah yang saya terangkan tadi tapi masih tak berjaya, then perlu bawa berjumpa doktor gigi untuk rawatan awal. Tetapi jika berjaya, then tak perlu jumpa doktor gigi, tapi kalau gigi masih tak betul, boleh jumpa bila diorang dah umur 12 lah, bila semua gigi kekal dah keluar. So now we move on to sign number 3, which is over-retained baby teeth. This is, again, I think most parents are starting to be aware, and actually most of them are quite good. They go to the dentist if they're concerned. Dan ini kita panggil gigi susu yang kekal terlalu lama di dalam mulut. Kalau kita tengok, if you look at all these 3 photos, you can see that all the baby teeth are still there, but then the permanent teeth have come through. If nothing is done about it, sometimes the permanent teeth can come through in the wrong direction or in the wrong place. So it's important, if you're not sure, bring them to a dentist for it to be evaluated. Okay, but it is important to also see if the baby tooth is loose or not. If they are really loose, then it's probably a good idea to try and let the child wiggle it out naturally first before taking them to the dentist. So how do you differentiate baby teeth and permanent teeth? Baby teeth are usually wider. They're a more bluish white rather than yellowish white. They're more bulbous, meaning they're shorter and very plump, and they're generally smaller in size, and they can also be worn down because they've been in the mouth longer than the permanent dentition, which has just come through at this age. Okay, so for sign number 3, the key points are any over-retained baby teeth in your child when the permanent teeth have already come through. And if yes, are the baby teeth loose? If they are loose, encourage your child to eat, fibrous, healthy things like apples and carrots, raw carrots. I know here we don't eat raw carrots so much, so maybe just apples and, fibrous fruits, or get your child to play it with their tongue and try and wiggle it out. If it is still not out after a few weeks, take them to the dentist. If the baby teeth are not loose and seems very firm, then you may need to take them to the dentist to evaluate whether they would need to have them taken out. But if they don't have any problems, just maintain regular follow-ups with the dentist. Jadi untuk tanda yang ketiga, yang poin penting yang perlu diingat adalah jika anak anda masih ada gigi susu, bila gigi kekal dah keluar di tempat lain, anda perlu tengok gigi susu tu longgar ke tidak. Kalau longgar, anda cuba bagi dia makan carrot, apple yang keras-keras yang sihat. Sebab carrot, apple ni bukan sahaja menggalakkan gigi tu gugur, ia juga menggalakkan gigi kekal tu keluar dengan lebih cepat. Tetapi kalau dah 2-3 minggu cuba tak goyang juga, tak cabut juga, then boleh bawa jumpa dentist. Kalau gigi tu tak longgar langsung, bawa mereka berjumpa dentist dan mungkin mereka memerlukan rawatan awal untuk cabut gigi tersebut. Tetapi jika tak ada masalah ini, boleh berjumpa dentist anda secara berkala macam biasa. Okay, so now we move on to sign number 4, which is our second last sign. This is a sign that is a little bit difficult for parents to see, but we hope that maybe they can be a bit more aware. So no signs of permanent canine by the age of 12 to 13 years old. This is when you're supposed, like I said, you're supposed to have all the full permanent teeth at this age. So which one is the permanent canine? So the permanent canine, if you look at my laser pointer here, is tooth number 3. So 1, 2, 3. So ini adalah gigi taring kekal, ya. Gigi taring kekal adalah gigi yang ketiga. So dia tajam. So this permanent canine is the cornerstone of the mouth when we smile. So people say it looks very aesthetic in a smile. They are very protective when we eat our food, and they can sometimes protect our back teeth from wearing out. And they are very strong. They have long roots. They are robust, and they are more resistant to damage. So we do want to try and keep these teeth if we can. So how does it look like when they don't have the permanent canine by the age of 12 to 13? If you look at these photographs, in photo number 1 and 2, you can see how the canine looks very small. It looks whiter as well, as you can remember the signs that I've told you about, how the permanent teeth are yellower than the baby teeth. And it's shorter, it's more plump, the same as photo number 2. So it is a clue that it might not be a permanent canine, it's still a baby canine. And if you look at photo number 3, again, this is whiter and it's also smaller and plumper as compared to the other teeth. And with photo number 4, it is a little bit more obvious because it's very worn down. Like I said, permanent canines are usually very resistant to decay and they're very strong teeth. So if they're very worn down like that, it is most likely that it is a baby canine. And unfortunately, this parent actually did not notice that her child has actually a missing canine until she's a bit older. So it is, I think, important for parents to at least see. If your child goes for regular checkups with the dentist could actually detect these things earlier. Maybe at 8 or 9, they can start see if the canines are coming through at the right location. But if not, you can have a look yourself when your child is a little bit older to see if it has already come through. So why is this important? Number 1, this is because we as orthodontists, we get a lot of late referrals of ectopic canines. Ectopic means that the canines are in the wrong location. And the reason why we don't want them to be detected late is because these canines can actually damage the roots. And unfortunately, it usually damages the roots of the front teeth. And you can see in these 2 photographs how it started to eat away the roots of the front teeth and here as well. And these are all late detection cases when the patients come at maybe 16 or 17. And another second reason why we want to detect this early is because if we want to pull, so we can use braces to pull the teeth down. And if we want to pull the teeth down, they are usually more successful when you do it at an earlier age rather than later. So it's more successful when you do it around 11 to 13 rather than when they're older. So this is why we want early detection of these cases where dentists play a huge role, but hopefully parents can also be more aware when you see your children, okay? However, like I said, we're not expecting parents to be dentists, and it's not always easy to detect. As you can see in some of these cases, their color is really similar to the other permanent teeth, but actually they are baby teeth. So you can see how in this case, it looks pretty much like an adult canine. It would be difficult for parents to see. And in the second photo, again, it is very difficult. I think the baby canine actually looks quite big here, but when you take an x-ray and you see the permanent canine is actually there, and is parked in the wrong spot. And this patient was also a late detection. She's like in her 20s. And fortunately, it was successful to bring the canines into place. However, sometimes if they're older, there is a high risk of the canines being stuck to the bone, and we can't really pull it out. So it's really important to try and detect these cases early. However, like I said, it's not always easy. So for sign number 4, the key points that you want to know is, do you think the permanent canine of your child is there at 12 to 13 years of age? If no, or you're not sure, you have to take them to the dentist to further investigate. If you're sure they're there, then just maintain regular checkups with the dentist. So untuk tanda yang keempat, yang penting yang ibu bapa perlu tahu adalah jika anda rasa gigi taring anak anda masih tak ada lagi dalam mulut, gigi taring yang kekal bukan gigi taring susu, dan anda rasa yang ada di situ adalah gigi taring susu, atau kalau anda tak pasti, boleh bawa mereka berjumpa doktor gigi untuk siasat dengan lebih lanjut, atau kalau anda confident yang itu memang gigi kekal, then boleh berjumpa doktor gigi secara berkala. All right, so now we move on to the last sign, which is the decayed first permanent molar before the age of 10. Atau dalam kata lain, gigi molar pertama, gigi kekal molar pertama yang dah rosak sebelum umur 10 tahun. So this first permanent molar actually comes through at the age of 6 to 7 years old. They come through very early, but to have them decayed before 10 is actually quite bad because they're permanent teeth, so they're not supposed to decay that early. To know which one is the first more permanent molar, if you look at my laser pointer there, tooth number 6. It's not that easy. This is assuming all teeth are there. But yeah, so at 6 years old, usually you'll have these permanent teeth here, and number 5 is actually a baby tooth. It's a baby molar tooth, but can be confused with tooth number 6, which is a permanent tooth. But if number 5 is decayed and you're confused, you need to take them to the dentist anyway, right? So it's fine. And yeah, so this is tooth number 6, which is a permanent tooth that comes out really early. So your child has to take really good care of them, because anyway, research has shown that if they've had decay on their permanent teeth early or on their baby teeth, it is most likely that they'll decay the other teeth as well if they don't take good care of them. So why do we need to find out this thing? This is because we want to know what causes decay at such a young age, before 10, they've started decaying. And because we want to prevent the same thing from happening to other teeth. And what causes decay at such a young age could be due to diet. For example, maybe they're eating a lot of refined sugars, or still bottle feeding, or they are not brushing their teeth well, or they're not brushing at all, or they have certain diseases like molar incisor hypomineralization. So we want to find out what causes them. And in some cases, the orthodontist can plan on the ideal timing of extractions of these teeth, usually before 10 years of age, to allow the second tooth next behind them to erupt nicely in place. So sometimes we can plan, and I'll show you in the next slide how a perfect timing of taking out these teeth can actually make them erupt nicely. And if you're not sure, you can see your dentist for an opinion. So I'll just show you a couple of examples of photos where the teeth are, the first molar, permanent molar, is extracted at different times. So the first one, you can see how it's extracted a little bit too early at around, I think, 7. And you can see how, although the space is closed, they're tilted, and you can see they're spacing at the front, and the teeth have tilted because of the space. So it's not the ideal time. And in the second photo, this patient's molar was taken out a little bit late when she's about 16. And this happens in most adults, where you can see the space remains. And if you don't put any prosthesis there, the other teeth next to it will tilt and into the space. And in the last photograph, you can see how the first molar is extracted at the ideal time by the orthodontist, and the second molar has erupted nicely in place. The wisdom tooth is coming behind later on and when the child is older, but you can see how you can't really tell that a tooth has been taken out. So for sign number 5, for the key points, you need to see whether your child have any first permanent molar that has already decayed before the age of 10. And if yes, or you're not sure, take them to the dentist for further investigation. Or if no, then just maintain regular checkups with your dentist. So untuk tanda yang terakhir ni, anda just tengok kanak-kanak anda, kalau dia ada gigi kekal pertama molar yang dah rosak sebelum umur 10 tahun, kalau ya atau kalau tak pasti, boleh bawa berjumpa dentist untuk semak dengan lebih lanjut, atau kalau tidak ada, just jumpa dentist anda secara berkala. All right, so this brings to the take-home message of my talk today. So we hope for parents to try and look out for these signs. Like I said, it's not easy, but you can always confirm with your dentist. Ensure regular checkups with the dentist. Ensure good oral hygiene and a healthy diet from a young age. And number 4, but it's quite important, show a good example to your children. So untuk ibu bapa di luar sana, cuba tengok tanda-tanda ini. Kalau anda tak pasti, anda boleh berjumpa dengan doktor gigi anda untuk kepastian. Pastikan anak anda berjumpa doktor gigi secara berkala dan pastikan pembersihan gigi dan diet yang bagus dari muda lagi. Dan yang penting, tunjukkan contoh yang baik kepada anak anda. Saya pernah ada seorang pesakit yang memakai braces dan tiba-tiba tahu dia selalu minum minuman berkarbonat, dan setiap kali jumpa dia setiap bulan dia asyik kata dia tak berhenti lagi. So last saya tanya dia kenapa susah sangat nak berhenti, dan rupa-rupanya dia cakap doktor sebab dekat dapur memang ada satu kotak, so saya susah nak tak ambil minuman dari kotak tu. So then I realised saya kena cakap dengan ibu bapa dia, janganlah beli kalau tahu anak anda tak boleh minum, ataupun janganlah minum juga. Jadi I think parents play an important role as well to show a good example to your children. Okay, so if you do suspect something looks funny, just bring your child to your dentist. The dentist will refer you to an orthodontist if necessary. I hope my talk is simple and easy to understand today. And if you have any questions, again, you can direct it at the end. With that, thank you very much.
All right, thank you very much, Dr. Asma, for your great presentation. Yeah, so to quote what she just said, if you're worried, if you know you're concerned about your child having, whatever reason, the teeth are overlapping, or there is an open bite because of thumb sucking, or for whatever reason, you can always book an appointment with a qualified dentist or orthodontist. Right, let's see some of the questions that we have in the comments section. Can we have all the speakers turn on your videos so any of you can answer these questions? Or if it's directed to the specific speaker, then the person can do that. So I think we've got quite a few here. Dr. Yasmin, are you there? Yeah. Okay.
Yeah, I'm here. Sorry, I think I lost connection a little bit just now. A bit breaky. Did you ask me?
Yeah. So the first question is for you, Dr.
I'm sorry, Dr. Alpha. I'm not sure if it's my connection, but you were sort of breaking.
mine?
You can hear me.
I can't hear Dr. Alpha as well.
Okay, I think Alpha, maybe Dr. Alpha, maybe your connection. Did you ask me?
Okay. Right, can you hear me now?
Yes, I can hear you.
All right, okay. So the first few questions will be for you. The
Great.
first one is, can you hear me now?
Yes, I can hear you. Thank you.
Okay, great. Okay, so what were the causes of death of the fake braces patients in Thailand?
Yes. Basically, there were 2 deaths, the 14 and 17-year-old. One was due to an allergy that subsequently resulted in some brain swelling, unfortunately. And the second was a thyroid swelling due to toxic leaching of toxic material from the braces. So very tragic.
I hope that answers the first. Yeah, very tragic. The second one, why are the patients afraid to lodge their complaints? And what can we do as dentists to help them?
Well, I think there's a few reasons. One of them, probably they're embarrassed, they're a bit shy, they think they've done something wrong. So they're worried if they make a complaint, then they will get into trouble as well. Then you also have those that are maybe worried for their safety because they may know the provider, it may be their classmate that's doing the treatment. And also this provider knows them and may have their contact details, maybe has even been to their house to put the braces on. So they may fear for their safety. So as a dentist, how you can approach this is to reassure your patient. If they want to make a complaint to KKM, they can become anonymous, and KKM is more than willing to protect their anonymity, so you don't have to worry. In fact, you don't even have to go to court, as a witness. You will just be providing information in the background, and also you will not be judged for receiving the fake braces. They will just educate you, and they're more than happy that you are coming forward to help them combat the fake braces providers.
Okay, and another question for you, Dr. Yasmin. Can you comment on the new trends of aligners in beauty centers?
Yeah, I guess this is another emerging topic. It's quite a big issue in countries like US and UK. In Malaysia, it's still in its infancy, so not too many cases, though we do see it happening. It's a very scary trend. It's also dangerous. Just like fake braces, they're bypassing the clinician, and also treatments being provided by fake practitioners that don't have knowledge about teeth or even orthodontics. I've heard cases of dentists talking about this blue jelly aligner that patients buy online, and the damage that it causes to the teeth. In fact, one dentist described the patient as having really, really wobbly teeth. And in fact, one tooth was so wobbly that it got sucked up the suction unit, so a lot of damage. It's quite scary. Also, when you talk about aligners, they need to fit really well, and it's not easy to take a good mold. I myself would have to repeat the molds a few times, but some of these aligner companies, they actually ship the mold material to your house, and the patient is supposed to take the impression or the mold themselves. This obviously is dangerous. The patient risks inhaling the material, and of course, if the impressions are not taken well, the aligners are not going to fit well, the teeth are not going to move where they should be moving. And also, if you don't have someone monitoring your treatment, all sorts of things can happen, just like the wobbly tooth that got sucked up the suction unit.
Right, okay. Before we move on, I'll just like to say thank you to those who posted their comments and questions. We've got quite a few already here. So the next one will be for Dr. Lau Mena. So the first question is underbite the same as crossbite?
Yes, in certain ways. So there are different types of crossbite. In professional term, anterior crossbite or posterior crossbite simply means whether the crossbite is at front teeth or at the back teeth. So for those at the back teeth, depending on the position of the crossbite, can be what we call as buccal crossbite or lingual crossbite. Don't be afraid of these terms, but today my topic that I shared just now is specifically for anterior crossbite. So an underbite is also called an anterior crossbite, where the lower teeth jutting out forward compared to the upper front teeth.
Okay, the next question for Dr. Mena as well, Dr. Lau. Once the underbite correction is treated, will the correction be permanent as the child continues to grow? Will it be permanent?
Nothing is permanent. Even for adults, they have to wear retainers. Not only do the teeth tend to move back to the original position, age can cause changes to the teeth as well, what called as age changes, tooth position. However, please do seek help, treatment from a registered orthodontist or dentist, because during the diagnosis, we will also look at favorable sign. For example, the overlap of the upper and lower front teeth. The more the overlap is, the better the outcome can be stable. So like, for example, if there is good overlap, so initially it is in underbite. Once we corrected it, the lower teeth will hold the upper teeth from moving back to the original position at the back. So orthodontists will look into stability and how they will advise you on how stable it is and how to manage stability as well.
Okay, we've got a few more questions for Dr. Dr. Lau. I hope you're okay with that.
Sure. I'm happy to answer the questions.
Next one is, at what age should face mask be started?
All right. In my slide, I mentioned that it is best before 10 years old. However, do not worry if your child is already 11 or 13. Okay. So as long as the child is growing, there is potential that you can be benefited by a face mask. So if your child is growing and having a skeletal underbite, please do seek professional management from an orthodontist as soon as possible. So we do have successful cases for patients who receive face mask treatment at 14 years old even, yeah.
Okay.
But do come early. Like I said, you can start to recognize underbite from 7 to 8 years old. Am I right? So if you come early, you may be treated at the best timing. Hi, Dr. Alpha.
Okay, another one.
All right. Okay.
Can you hear me?
Yeah, I had problem hearing you
Okay.
just now, but I'm okay now.
Oh, sorry. Okay.
No worries.
I'm not sure. It could be my connection. Right. Another question for you. I noticed in a 2-year-old child, the 4 lower incisors located in front of the upper incisors. So yeah, okay. So the 4 lower incisors are located in front of the upper incisors. Does the diagnosis of the underbite apply to this child, and how to meet the dentist?
Thank you for the
How to meet
question.
dentist?
So an underbite or anterior crossbite can be used to describe the condition for both baby teeth and also adult teeth. However, we usually do not treat the baby teeth. First of all, because it is not permanent. When the adult front teeth come through, they might not be in crossbite. So number one. Number two, because the child is so young, 2 years old, like you said, the example that you are given, they might not, not many options available. There are some suggestion given before, some dentists may help to trim a little bit of the baby teeth so that the sheath can be corrected and the baby can bite in the correct position. However, it is a case-to-case basis. So if you are worried, particularly for an anterior crossbite for baby teeth, you can seek advice from an orthodontist as well. Yeah. But we usually treat the permanent teeth. Yes.
Right, next question. In adults with class 3 malocclusions, I'm guessing this is from a dentist, how do we determine whether surgical treatment is needed for or only orthodontic treatment, I think she meant, or he.
All right.
So in adults with class 3 malocclusion, how to determine whether they need surgery or just orthodontics?
So unfortunately, because this webinar is aimed for public awareness, so I cannot use a lot of technical terms. It can be more than 1 hour lecture to talk about indication and contraindication, what sign you should look for, which one is for surgery only, which one you can do it without the surgery. Like for example, the severity of the skeletal underbite, the angle of the upper and the lower front teeth, and how much overlap you have for the upper and lower front teeth. There are many signs that we have to investigate, both clinically and also radiographically, meaning we can get some info from the radiograph as well. So if you are a dentist, do refer your patient to an orthodontist for proper investigation and management. If you are a patient, if you're not sure, just check out our website and look for professional advice from any orthodontist. Yeah. I hope because yes, I cannot, it might be too difficult for maybe a mother who has no knowledge of
lecture, isn't it?
Yes.
I agree. If you're not sure, if you're worried about your patients, or just refer to an orthodontist who will be able to do appropriate analysis.
Yeah.
Right. Next question again for Dr. Lau. Sorry, are you okay? Yeah, we have quite a few for you.
Good.
Right. 6 years old with prominent protruded mandible, is a face mask suggested? How does this pause the growth of the mandible?
Yes. So unless it is a fake skeletal underbite, So unless it is a fake skeletal underbite, if it is a true skeletal underbite where you see that the mandible is, longer or protruding forward, a face mask can be an option. So you are saying 6 years old, am I right?
Yeah, 6 years old. Would you
6 years
recommend?
old. 6 years old, perhaps the adult upper and lower front teeth has not come in yet. So like the very first question, this may be an anterior crossbite or an underbite for baby teeth. So perhaps it is a little too early, but we can monitor. By the way, don't worry to seek consultation early. We do monitor a child that may potentially have an underbite and advise for a proper treatment at the best timing. So you can always bring your kids in early for orthodontic consultation.
The second part to the question is, how does this
Yes,
growth
thank
of the
you. Thank you.
mandible?
Thank you for reminding me. So the face mask correct the dental underbite and also improve the skeletal underbite. What do we mean by improve skeletal underbite? It can actually restrict the growth of the mandible forward and promote the growth of the upper jaw forward. So this is how face masks work. So yes, it because of the rest on the forehead and the chin, and also the elastic that pull the upper teeth and upper jaw forward, the research shows that it restrict the growth of the lower jaw and promote forward growth of the upper jaw.
Right, last question for you, Dr. Lau. How many hours a day to wear a face mask?
Good question. Thank you. Whoever you are, thank you for asking this question. So I missed it. I actually wanted to explain about this in my slide. So typically it is about 14 hours. However, different orthodontists may have different protocol. But if you are seeking treatment from a registered orthodontist, rest assured that your orthodontist knows what to do, because they are properly trained to provide treatment, including face mask therapy as well. So typically 14 hours. Conventionally, before the pandemic, when the kids go to school, they do not have to wear the face mask at school, or when they go out shopping or eat out. They usually wear after dinner and wear it throughout sleep as well. That will meet the minimum requirement of about 14 hours. And actually right now with the pandemic, my patients who are wearing face masks, it really work well now, because they are at home, and they can wear it longer hours at any time, because now is the era of online learning and online school. Yeah. So perhaps it is, if the pandemic is over, the child go back to school physically, don't worry. It is only for 14 hours, usually after dinner and throughout sleep.
All right, thank you for the explanation, Dr. Lau.
Thank you,
Let's move
Afa.
on to Dr. Asma. We've got quite a few questions for you as well.
Sure.
The first one, if a kid has done surgery for cleft lip and palate, growing up with small upper jaw, is it recommended for the removable of fixed braces or surgery?
Okay, so for patients with a cleft lip and palate, this is a very special condition, which is quite complicated and usually would require referral to an orthodontic specialist. And usually these patients are, if they've had surgery before, usually there will be a team looking after, and usually it's a multidisciplinary team with an orthodontist, with a max fac surgeon, with a pediatric dentist, speech therapist, ENT. So it is a complicated situation that we will need to assess on a case-to-case basis. And yes, so make sure that you are taken care of in a hospital setting, or at least, if you're not sure, just make sure you see a specialist orthodontist to see, because it's not a straight yes or no answer, because some of them do need surgery later on, but some can do well without surgery. So it is a case-to-case evaluation.
The next question, would you advise headgear therapy for class 2 malocclusion as an interceptive treatment in growing children? If yes, at what age?
So for headgear, it is something that is less commonly used nowadays because of the safety issues. However, it is still used in specific cases, but we usually start headgear when they're in full permanent dentition, which is around 12. For the twin block or something a bit more interceptive at a younger age, we usually just use the twin block on its own. We rarely start it with the headgear. And again, this is on a case-to-case basis and it needs to be evaluated by an orthodontic specialist. Hope that helps.
Okay, the next one. Is it better to get orthodontic treatment from private sector or from the government sector?
Okay, this is a common question actually. So for government sector, they do accept all cases for children under 18, and they have a specific criteria to see whether your child really needs orthodontic treatment or not, because we can't cater to, all the population. So we only select, for those who really need treatment. And another option is university, where they do accept a certain criteria for treatment as well, but they do accept all ages. So for example, like we are from UM and UKM, and we have other universities as well. So we all have that certain cutoff points that we can accept patients for treatment. And of course, it's if patients opt to go for private, obviously they have more time to see them. They can see them on weekends, etc. So, and of course, that cost is slightly higher on the private side. You can opt to go for private as well, but make sure that if you want to have braces, make sure you see a specialist orthodontist. And if you're not sure, you can look at, Dr. Yasmin has shared the slide on how to search for specialist orthodontist on mao.org.my. So you can search for the area that you want and find the orthodontist of your choice there. Yeah.
Next question. What happens if my son has an increased overjet, but he does not have any problems with it? What do I do?
So if your child has an increased overjet and does not have any problems with it, it probably means that they do not need any early interceptive treatment. However, their teeth will still have a big gap and they will still have an increased risk of trauma. So ideally, they would still need to have it treated at the right age. So when they're in full permanent dentition at about 12, they do need to see an orthodontist to have it fixed. And before that, if they don't have any problems, we still would advise them to refrain from, doing any high-risk activities that can cause injury, or at least if they still want to participate in contact sports or things like that, they will need to wear a mouth guard.
Okay, I love how our audience have, picked up all these words. So could be dentist, overjet, and yeah, interesting. Okay, the next one is quite a funny one. I got bullied by my rabbit teeth. I got bullied with my rabbit teeth.
Okay.
Even after I got braces treatment, my friends still mock me and call me Gigi Basi. What are your thoughts, Dr. Asma?
My thought is you need to find new
What do you
friends.
think?
Find new friends.
I think so too.
Actually, we have a lot of, I think it's fine. Having braces will actually correct your teeth. And for your friends to, first start from calling you rabbit teeth and then, Gigi Basti, they're quite mean. But, braces are quite the trend now. As you can see, some people even wear them for fashion. So be proud and, just tell them, I'm getting my teeth fixed. I will get really a perfect smile after this. And you'll all be jealous of me once I get my perfect smile. It's just something that, it's something that you can control. So when they're teasing you, just tell them that, you're doing the right thing and you're correcting your teeth, and wait until I get my braces off. So just take care of your
braces off, they'll be jealous.
Having braces are cool. I think most of us here have had braces as well. So you can see how well aligned our teeth are now.
Right, next question. Oh, more serious one. If a 12-year-old boy presents with an unerupted 1, 3, 2, 3, and 3, 3, so 4, 3 erupted, and all other teeth aligned, do I need to refer to an orthodontist? Okay, 12-year-old boy, unerupted 1, 3, 2, 3, 3, 3, so just the 4, 3 that's erupted, and all the other teeth are aligned. Do I need to refer to an orthodontist?
So yes, if you think they're still not there, and I think this is coming from someone probably with some dental knowledge, because they're quoting the teeth in notation quite nicely there. If you're not sure, you can always get your child to see a specialist orthodontist for us to further evaluate, because we're not sure what we need to check with x-rays whether the teeth are in the right position, etc. So yes, then again, you need to see specialist orthodontist for further evaluation. Hope that helps.
All right, just for the rest of you who might not know what we're talking about when we say 1, 3, 2, 3, 3, 3, these are canines. So I think Dr. Asma explained before the tooth number 3. So it's at the corner of your mouth, the pointy one, the sharp tooth, the canine teeth. So
Yes.
these are what we call number 3. So one is, when we say 1, 3, is referring to the section. So it's the upper right section. And then
Yes.
2, 3 is the upper left section. So yeah, so now you know when you go to an orthodontist or your dentist, when they start saying 1, 3, so that's the upper right canine.
Yeah, so
Okay,
3, like I
moving
said,
on.
the slide basically just means tooth number 3, so it's the pointy tooth.
Right, moving on to the next question. Certain orthodontists advocate early orthodontic treatment to treat breathing problems. What is your opinion on this controversial topic? Interesting one.
Yeah, interesting. I think, again, this is on a case-to-case basis, and we need to evaluate what are the causes for the breathing problems and how severe is the breathing problems. Usually we have like a sleep score questionnaire and things like that to evaluate how serious it is impacting on the person's quality of life. So again, this is something very specific that would need to be evaluated on a case-to-case basis. And as long as it's been treated by a specialist orthodontist, I think you're in good hands there, as long as it's not by fake dentist. So yeah.
Sorry, I got cut just now. Did you finish answering the question already?
Yes, I did.
Okay, sorry.
No
We
worries.
all heard her. It's fine.
All right, good. I think that's all. Do you have any other questions? I think that's all for today. Yeah, okay. So I think we've come to the end of our webinar today. I hope you've enjoyed it. I certainly have. And, you could take back some insightful knowledge. So now you know, things like, what are fake braces? What's all this worry that we have among orthodontists and dentists, about underbite as well. So when is it that you need to recognize that your child needs to see an orthodontist or a dentist for different problems regarding bite at an early age? Okay, please fill in the feedback form attached in the chat box if you would like to have an e-certificate or CPD points. I think we provide 2 CPD points for your participation. Also, please take a moment to like this video. The recording of the live session will also be available on the MAO website, University of Malaya Faculty of Dentistry Facebook page, and also the UKM Facebook pages as well. Okay, you can also go on our website to review the webinar or go through some of our content if you missed it. If you have any further inquiries or if you've missed anything, any of your questions, you can always ask us on the website as well. And this is also where you can find a list of qualified orthodontic specialists in your area in the search directory. Right, so for your information, this webinar is brought to you by the Malaysian Association of Orthodontists in collaboration with the University of Malaya Faculty of Dentistry and University Kebangsaan Malaysia Dental Faculty. And all our speakers today are fully qualified and certified specialist orthodontists and members of the MAO. So on behalf of our guest speakers and the Malaysian Association of Orthodontists, I'm Dr. Alfa Dahlia, and I would like to thank you for joining our webinar and taking time to view our presentations. Take care, everyone. Have a great weekend. Bye.